My name's Angela Bell and I'm a specialist practitioner district nurse. I always wanted to be a district nurse, so all through my nurse training I knew, working in like having my placements in the hospitals, that it wasn't something that attracted me. My mum was diagnosed with a terminal illness, and seeing the district nurses come into care for her really made me decide that district nursing was where I would want to be. And then being in the hospital, like I say, just backed that up. So you go into hospital and people have to get up at a certain time, they have to wear certain clothes, they have to be washed at a certain time, eat at a certain time, go to bed at a certain time. And for me, the whole idea of nursing is nursing a patient where they're comfortable. So to do that in their own environment was absolutely amazing. And it's a privilege to go into somebody's home and care for them. You're a guest in their environment, they're comfortable, they have everything around them that they want. So yeah, I always knew district nursing was for me. So I didn't have a great start from leaving school. I left school with no GCSEs. I wasn't very academic. My mum was a nurse, and then, like I say, my mum was diagnosed at 57 with Lewy bodies dementia, and helped my dad care for my mum. Then I got married and my husband was in the army, so I kind of just moved about around the country working. And then it wasn't until just before my mum passed away that I thought, actually, I could do this. And my mum said to me, she said, if you can give this care to me, you could give this care to anybody. And that really stuck in my mind. So probably 2 years before my mum actually passed away, I looked at what I would need to get to university. Never in my wildest dreams would I think that I'd be where I am now with no GCSEs. But I went to college and did an access to nursing course, and got my credits, enough for me to be able to do my advanced diploma at Sheffield Hallam University. And then I went on there to do my nursing training for 3 years. And just before I started my nurse training, my mum sadly passed away in the July, as I started in the September. And most people probably would have said, no, that's it, I need to defer. But it was like a burning desire in my heart that I had to do this, not just for me, but for her too. So I went on, did my nurse training, and luckily had my last placement in the community, and I just knew that this was where my heart was. So luckily applied for the post and got it with the trust, and I've been here up now, just coming up to 11 years. I worked as a band 5 nurse up until about 4 years ago, when I just thought, I'm ready now, I'm ready to develop. So I came to Larwood as a band 6 seconded nurse, and then was lucky enough to get onto my district nursing training in 2019 and came back to Larwood as a district nurse. I mean, for me, I'm really happy doing the role that I do now. I absolutely love my job. However, I would never say never to development. My team leader currently is always really proactive in looking for future development things for us to do. I suppose the next thing for me is looking at being a practice supervisor for DN students. And then eventually, we'll see where my career takes me. But whatever happens, I want to stay clinical, because I absolutely love seeing my patients. I would say I'm most proud of my journey. I think it's really difficult when you leave school with nothing, but know that you could do something. So I think for the sheer grit and determination of going and getting my credits to go to university, studying, doing my advanced diploma, but then being a district nurse student coming out with a 2-1 degree, I would never have thought that at 16 that I would be where I am, and I am proud of my journey. So I would say, yeah, my journey into where I am now is my proudest moment.